course, we've examined the organizations, the services, and the people within the 3 Ps, the providers, the producers, and the payors. Each of these are sectors of the healthcare industry. We also discussed that services could be categorized within each sector as either clinical or non-clinical. Today, I want to discuss a different type of categorization of healthcare services. This categorization is based upon the focus of the care that is being delivered. This slide introduces the 4 categories, and let's take them one at a time. Health promotion, disease prevention, diagnosis and treatment, and rehabilitation. I like to think of this as a funnel, starting broadly at the top with health promotion and getting more and more narrow as we work our way down to rehabilitation. Health promotion strategies mostly have a wide scope. They do not primarily target specific health gains, nor do they usually target specific causes of ill health, such as diseases. Instead, they target healthy populations. Some examples are exercising more, eating better, drinking less alcohol, strengthening your community ties, getting control over the determinants of one's life. All of these aim for increased health and increased resistance to many kinds of diseases. Examples of health promotion services or activities include public investment in walking and biking trails within our communities, public education about healthy eating, legislation to subsidize fresh, healthy food within food deserts, community initiatives to create supportive networks for isolated elders. Some health interventions fit both within the categories of health promotion and disease prevention. Disease prevention is the next level of services and categorizations that we will look at. Disease prevention strategies mostly focus narrowly on specific diseases. This might be screening for a specific type of cancer, vaccinating against a specific virus, minimizing salt intake in order to reduce hypertension, reducing sugar consumption in order to reduce obesity, etc. To a large extent, this, in fact, means targeting populations that already have a disease. For example, those with an undetected cancer, who are obese or suffer from hypertension. And even if there is no disease, the aim of disease prevention is often to reduce the risk of some specific future diseases. For example, reducing lung cancer through reducing smoking, or reducing the spread of sexually transmitted diseases, or STDs, through encouraging use of condoms. Disease prevention strategies often target at-risk groups, either those who have some disease, maybe at an early stage, or those who run a higher risk than others of developing a disease. Next, we have the diagnosis and treatment. There are a variety of technologies used here, including diagnostic equipment and processes such as lab tests, x-rays, and other methods of viewing the internal structures and processes of one's body. Other technologies used in diagnosis and treatment include medications, gene therapy, implanted devices, mechanical and surgical manipulation, and treatments using electrical currents. In the U.S. healthcare industry, the majority of our resources are directed towards diagnosis and treatment. Individuals and groups attempting to solve the high cost of healthcare argue that more resources need to be spent on health promotion and disease prevention in order to avoid future illness and healthcare costs. The Affordable Care Act of 2010 implemented a number of programs and strategies to increase preventative care. For example, health plans are now required to include specific preventative and screening services, such as immunizations, screening for hepatitis B and C, and diet counseling for adults at higher risk for chronic illness. Rehabilitation services often follow the diagnosis and treatment, but they may not be required for all patients. Rehabilitation services may be provided for a short time, but are often required for longer periods. Take, for example, a 72-year-old man who has a knee replacement. He will receive rehabilitative services from physical and occupational therapists while at the hospital. He may be discharged from the hospital to a short-term rehabilitation facility for 1 to 2 weeks until he is strong and stable enough to care for himself at home. After he goes home, he may participate in outpatient rehabilitative services several times a week at a local physical therapy clinic for several months until he gains the strength and mobility of his knee. Now, we will talk a little bit about the goals of the healthcare industry. We call this the Triple Aim. The Triple Aim is a framework developed in 2007 by the Institute for Healthcare Improvement, or IHI, that describes an approach to optimizing health system performance. It is IHI's belief that new designs must be developed to simultaneously pursue 3 dimensions, which we call the Triple Aim. These are improving the patient experience of care. This includes quality and satisfaction. Improving the health of populations, and reducing the per capita cost of healthcare. Per capita just means the individual patient costs. Organizations that adopt the Triple Aim strive to develop and improve systems that simultaneously achieve the 3 dimensions. The concept of the Triple Aim is now widely used because of IHI's work with many organizations, and also because of the adoption of the Triple Aim as part of the National Strategy for U.S. Healthcare. This was developed during the implementation of the Affordable Care Act of 2010. Even those organizations working on the Triple Aim before IHI coined the term found the concept to be useful because it helped them think about all 3 dimensions at once and to organize their work around them. True Triple Aim improvement cannot be realized by healthcare systems acting alone, nor by solely delivering high-quality care at lower costs. Improving health is a challenge that requires the engagement of partners across the community to address the broader determinants of health. The Triple Aim is intended to reduce costs on a per capita basis. Simply slowing unsustainable growth in costs is not good enough. We must find ways to reduce the per capita costs and allow society to use these resources in other ways.